Hi, it's Casey, and I wanted to make another video because it's 12 days post-op, so since I had my double mastectomy and reconstruction, and it's been hard. It's been really hard, I'm not gonna lie, and I just wanted to go over things that I wish I knew or that hopefully will help somebody else. So, you know, first off, coming home from the hospital, you know, it doesn't look good, but you expect to keep healing, but instead it gets worse. I'm going to show you guys some pictures, so just warning to you right now, but it's one of the worst parts about recovery. The surgery is the easy part. One of the worst parts is the recovery, because it gets really dark and the skin gets worse before it gets better. So one positive thing that happened today was I went to a doctor. At first I was really freaked out because, like I said, it's been really depressing. And that's one of the things that I kind of wish I knew to expect more of. I knew it wasn't going to be easy, but I was terrified today because when I checked out my breast, the right one that I had originally had biopsied, it's looked different from the left the whole time, but today it was considerably worse. So it terrified me because I thought I had an infection. Thank God I don't, and I was actually able to get one of my drains out, so that was good. But I've got the okay to finally wash it. I mean, I haven't really been taking, you know, complete showers because you have to avoid that area at first, especially because it's open wound. So, and now that I actually have more range of motion, because originally I got my implant under my pectoral muscle, of course, because, you know, that's the only way it's going to sit right. So for me, somebody who has a lot of upper body muscle, I had a lot of trauma to my muscles after it, so I didn't have a lot of range of motion. So today was the first time I was able to really take a shower and clean everything and wash my hair. So happy about that. So to take care of your drains, you know, because the thing is, you don't want to get infected. You want to have an alcohol pad, and you start where the drain comes out on your side, and you kind of just wipe all the way down, and then put a little bit of Neosporin, because it's a lot of dead tissue and it doesn't look cute and it starts scabbing off. So you want to put just a little bit of Neosporin, and then I use the non-stick gauze pads. If it wasn't for these, I would be peeling off tissue every time I change them. So you'll see that, and make sure you have a really good sports bra, because when you come out of surgery, they give you a bra, but it's really uncomfortable. So I've been relying on these sports bras, and as you can see, I line the edge with the gauze. So, taking this is how I hook up my drain so that you can't see it. Because when you gotta leave the house, like, one of the parts of, like, self-esteem that I've been struggling with is trying to hide these drains, because they stick out of your shirt. So I actually got one of my drains removed today too, so that's a good thing. I just have one to hide. So I created my necklace, and then on top of that, you gotta do scarves. So that's my tip to you, is to get scarves to hide the drains. So that's it. So you need to have somebody that you can depend on to be there. I'm thankful for my father, who comes here and he'll take me to PT. I can't drive yet, you know, I'm in knee rehab as well, and that's one of the benefits of actually having both these surgeries at the same time, is because I keep hearing the word, like, in my head, demoralized, because I've never had issues with confidence, and not being able to exercise and work out, it's been really hard to release myself and to have an outlet for all these emotions that I'm feeling. So when I go to PT, it's nice to be able to see progress in my knee rehab, and it builds my confidence and makes me feel better about the entire situation. If you know anybody who is having surgery, or you yourself just found this video and might be having surgery, please try to contact me through Facebook or through YouTube, because there's a group page that I found. It's a private online forum, and it's for women who are going through this exact same thing. And having these people to talk to is imperative to your healing, because since I don't know anybody who has gone through this, and I've met people online who are able to calm my fears, and they've been to the worst of the situations. So to see the range of women of ages and geographical locations and experiences, it really helps. So I want to thank Lisa for letting me in the forum, and I want to extend the invitation to invite anyone who will be undergoing the surgery as well. Even though it's really hard dealing with self-esteem issues of having scars and scabs, and dealing with, dead skin, and not knowing if my nipple is even going to be able to make it through, the one thing that resonates in the back of my mind when I start to get really down about everything is that I'm never going to have breast cancer. So for that, it's all worth it.